Okay, I'll just do a quick sound check and make sure everyone can hear me, and we'll give everybody just a couple more minutes to join the WebEx. Okay, I want to thank everyone for joining us for this media briefing about COVID-19 in Idaho. My name is Niki Forbing-Orr, and I'll be moderating today. Please note that everyone should be muted unless you are speaking. It looks like everyone is. I want to make a note that ASL interpretation is available today. You can search for the window for interpreter stubs, and then if you hover over the three little dots to the right in that video window, you can lock it in place, so it's always visible. Today, Health and Welfare Director Dave Jeppesen will begin the opening remarks, and then we'll hear briefly from Public Health Administrator Elke Shaw-Tulloch, Public Health Medical Director and State Epidemiologist Dr. Christine Hahn, and Deputy State Epidemiologist Dr. Kathryn Turner before we open it up for questions. Idaho Immunization Program Manager Sarah Leeds and Idaho Bureau of Laboratories Chief Dr. Christopher Ball also are in attendance today. So with that, I will turn it over to Director Jeppesen.
Well, thank you, Niki, and let's welcome everyone to our COVID-19 press briefing for this week. The overall state COVID-19 numbers continue to look very good. The statewide 7-day moving average of cases per 100,000 has dropped below 10 over the last week, which is the lowest we've seen in some time. COVID-19 testing positivity remained below 5% for the last 4 weeks in a row. And the number of long-term care centers with active COVID cases continues to decline and is currently at 30 out of 400 or so facilities. COVID-19 hospitalizations had a downward trend last week, and COVID-19 ICU stays remained flat, but higher than we would like to see. However, the vast majority of Idaho hospitals are operating as normal, and no hospital in Idaho is facing resource limitations. I just want to take a second to say thank you to Idahoans for your efforts that have resulted in some of the best COVID-19 numbers we have seen since last summer. Speaking of summer, as the weather gets warmer and more of us are doing things outside, we know that will help in keeping Idaho COVID numbers low. For all of those reasons, I'm pleased to share that today, Idaho is moving to stage 4. As you already know, Idaho has been open for business for months, which has resulted in Idaho having the strongest economy of all 50 states. Moving to stage 4 means that Idaho will remain open for business. The major change in stage 4 is that gatherings of any size can be held. Stage 4 will continue to have recommendations on COVID-19 safety protocols for gatherings, as well as recommendations for Idahoans and employers. The new stage 4 Stay Healthy guidelines can be found on the coronavirus.idaho.gov later today, and more specific COVID-19 recommendations can be found at rebound.idaho.gov. One additional reason that Idaho is moving to stage 4 is because so many Idahoans are choosing to get vaccinated. Over 623,000 Idahoans have had at least one shot, which includes almost 74% of those over the age of 65. However, we are counting on even more Idahoans choosing to get the safe and effective COVID-19 vaccine. The COVID-19 vaccine is the best choice we have to keep the coronavirus spread under control, to continue to fuel the Idaho economy, and to ensure that our kids can go back to school in the fall. And with that, I will hand it over to Elke.
Great. Thank you very much, Director, and hello, everyone. Today, I just want to give you an update on our mobile vaccine grants that we talked about last time we were here. I'm going to start by saying that it is very exciting that we're able to loosen our restrictions in the state on gatherings, especially, and move into stage 4, as the Director talked about. As he said, we're doing everything we can to allow for more opportunities for us to get back into our usual routines. And part of a full return to normal is to get more people vaccinated, as the Director said. However, our vaccination rate needs to increase, and we need the help of all Idahoans to bring that rate up. One of the things that we are doing to assist in increasing our vaccine rates is to offer these mini grants for mobile vaccine clinics. As a reminder from last time, the department is making $9 million available in mini grants on a first-come, first-served basis. We want to encourage the availability of mobile vaccine clinics, direct service delivery for homebound and other populations, pop-up clinics, and more. To date, we have awarded 3 grants that were approved on last Friday. We awarded $500,000 for an organization that will focus across the state on mobile vaccine with an initial focus in northern Idaho in coordination with local public health and a focus on tourism and the hospitality industry. Our second award was made to a provider. It's a pharmacy provider that will serve the Magic Valley for $345,000. And our third awardee is for a collaboration between a not-for-profit organization and a university that will serve southeast and eastern Idaho for a total of $497,000. We did have a 4th application that was reviewed and determined to be incomplete in the application, so we're working with the applicant to provide all the information so that the committee can re-review it. We're planning on reviewing these grants. The committee that's reviewing is meeting every Friday, and we'll even include those that were admitted the previous week. After all the grants are reviewed, the immunization program immediately establishes a contract with that provider or group of providers, however the application comes in, or the applicant, so the vaccine work can begin as soon as possible. Requirement of each successful application is that they begin vaccination within 21 days of a fully executed contract. All awarded applicants will ensure coordination and awareness of activities with local public health departments, who in turn work with all the local providers. We want to make sure that we're getting to those areas of greatest need and making sure that we're filling gaps in vaccine administration across the state. The immunization program is tracking which areas of the state and what populations of community members are the focus that each awardee will be working with. And so as we track this, we'll be comparing it to areas of low vaccination rates to ensure that we are focusing on those access barriers for Idahoans who want the COVID-19 vaccine. With that, I'm going to turn it over to Dr. Hahn.
Thank you. Just getting the old unmute here. Thank you, Elke. So I want to just talk briefly about the Pfizer vaccine. I know that you are all aware that the FDA announced yesterday that it has been authorized to use the Pfizer vaccine now for youth age 12 to 15. What we are waiting for now is the CDC's Advisory Committee on Immunization Practices will be meeting tomorrow to make recommendations in that age group. And one could think, what recommendations might they make that's different than what's already being done? And possibilities would be things such as different considerations for this younger age group. Sometimes adolescents react differently to vaccines or might have more incidence of fainting like has been seen in some other vaccines. So there are reasons to wait until we see exactly what the advisory committee recommends tomorrow. But we are hoping that after tomorrow's recommendation, CDC will hopefully approve those recommendations and make them adopt them as CDC recommendations, and vaccination can start on Thursday in this age group of 12 to 15. So we're very excited about that. We know that the 16 and 17-year-olds have already started getting vaccinated, and the rates are not what we would like to see in that age group. Just looking at the numbers today, Dr. Turner and I kind of took a look at them this morning and came up with about 15% of 16 to 17-year-olds currently have been vaccinated in Idaho. So long way to go. We know that younger people, of course, need parental consent, just like for now, the 12 to 15-year-olds will, of course, also need parental consent. Also, they're still in school. You know, they are at lower risk of personal severe disease or death, but certainly still can have very severe outcomes, such as what you'll hear about later from Dr. Turner. So we realize we have a lot of work to do working with parents and providers to try to get this vaccine implemented in this age group, but we are pleased that the FDA has taken this important first step. As a reminder, the vaccine trial carried out by Pfizer did show that young people seem to tolerate this very well, and they had actually very good antibody responses, even higher than in their in the 16 to 17-year-old comparison group, and they were protected against the disease. In fact, in this very small trial, and I say very small, meaning compared to the millions of folks that will eventually be eligible for the vaccine in this age group. But in that small trial, they had no cases among the vaccinated kids and 18 cases in the placebo group. So it looked very good, like the vaccine worked very well and was very well tolerated in this age group. So we're very excited about that and look forward to starting to work with parents and providers on this vaccine. And with that, I will turn it over to, and I apologize, I think it's Dr. Turner next, or Dr. Ball.
Yeah, Dr. Turner, thanks.
Okay.
Thanks, Dr. Hahn.
Thanks.
Yeah, good afternoon, everyone. Today I'm going to provide some brief updates on some subsets of Idaho cases. First of all, regarding Idaho cases identified as infected with variants of the COVID-19 virus, I'm going to throw a lot of numbers out at you. So the B117 variant, which is the one first identified in the UK, has been identified among residents of over half of Idaho counties. 6% of those cases have been hospitalized with an average hospitalization stay of 7.5 days. So this is the variant we're finding most often in Idaho. We are also seeing additional detections of the B1429 or B1427 variant. This is the one that was first identified in California. This variant has been identified among residents of nearly all areas of the state, although in smaller numbers when compared with the B117. The B1526, and this is the variant that was first identified in New York State, has been identified in the northern part of the state and the Treasure and Magic Valleys. We've had no additional detections of the B1351 variant. This is the one that was first identified in South Africa, since we initially had 2 cases reported when we started tracking variants. The first detection of the P1 variant, which was first identified in Brazil, was reported at Central District Health 2 weeks ago, and this variant was detected in a sample from a northern Idaho resident last week. So we have 2 cases of the P1 variant. And finally, we are fully expecting to detect the B1617 variant. This is the variant that was first detected in India and is circulating in India right now. Our neighbors have all detected that variant, including Utah, Montana, Nevada, Washington State, and California. And it was recently added to the CDC's list of variants of public health interest. And so we fully expect that at some point we will detect that variant in Idaho. We don't have a ton of cases identified in Idaho so far, just over 300 as of today. So we can't necessarily generalize about cases that we detect a variant in, not only because we have some small numbers, but also because we are prioritizing genomic sequence testing with a bias towards actually finding the variants. The Idaho Bureau of Laboratories continues to perform sequencing in Idaho and is working with partner laboratories to increase capacity for this testing within the state. And we are also receiving sequencing results from national laboratories. However, I think the takeaway here is that we know there's variants circulating, and we know that as the virus continues to be transmitted, the chance of virus mutations increases. So far, we've been really fortunate that our current authorized vaccines protect against the variants. Increasing vaccination rates and keeping case counts down will help ensure we don't end up with a variant of the SARS-CoV-2 virus that vaccines are not effective against. So switching gears, I'm going to talk about children specifically, since the big vaccine news this week that Dr. Hahn discussed and shared with you is on the FDA authorization of the Pfizer vaccine for children 12 to 15 years of age. You're all aware of this, but I'm just going to recap a little bit that most children infected with the virus that causes COVID-19 have either very mild symptoms or asymptomatic. In other words, they don't have any symptoms at all. You can't tell they're infected. So while they are still able to transmit the virus to others, they don't display any symptoms, and parents wouldn't necessarily know they're infected unless these children are tested for some reason, such as they were identified as a contact to a known case or some kind of surveillance testing. Idaho children 12 to 15 years of age make up just over 3.5% of the cases in Idaho over the course of the pandemic, and just under 1% of those kids were hospitalized for their illness. Conversely, kids in this age group are 1.5 times more likely to be asymptomatic when compared to Idaho adults. So while they may be a small proportion of the total cases, infections in this age group are likely undercounted because they don't display any symptoms and may never be tested or diagnosed with the infection. So all that said, there is a condition called multisystem inflammatory syndrome in children. This is abbreviated as MIS-C, and it is related to infection with the COVID-19 virus, specifically in children. The syndrome appears to be a result of an excessive immune response to the virus, and different systems in the body become inflamed, and it seriously affects all different organs and systems throughout the body, including the heart, blood vessels, kidneys, digestive system, brain. And right now, scientists are trying to get a better understanding of what triggers this sort of exaggerated immune response. However, there are some things we do know about the syndrome. First, we know that most of the children affected have a positive serologic test for SARS-CoV-2 and negative viral tests. So what this means is they aren't actively infected with the virus that causes COVID-19, but they have antibodies that indicate they were infected by the virus at some time and they had this infection and it wasn't detected. This finding supports the hypothesis among researchers that the syndrome is related to an unusual immune response that occurs after acute infection has passed. We also know that in children who have a known history of COVID-19 disease, so these are the kids that they were identified as being infected in the acute phase, the time between their acute infection and the onset of MIS-C symptoms is approximately 2 to 6 weeks. Unfortunately, for many of the cases, the duration of time between when they had that acute infection and when they started experiencing symptoms of MIS-C is unknown because they never had a positive viral test or had symptoms of acute infection. So children with MIS-C may have a fever and other various symptoms, including abdominal or tummy pain, vomiting, diarrhea, neck pain, rash, bloodshot eyes, or just complain that they're feeling extra tired, or maybe a parent observes that they're extra tired. These are the signs parents should watch out for and notify their healthcare provider about. 26 cases of MIS-C have been reported in Idaho, and among those cases, on average, 4 body systems have been impacted. The most frequent is hematologic system, including the blood vessels. Second most frequent is the gastrointestinal system, including the liver, and the third is the cardiac system, your heart. 62% of Idaho cases had an exposure to a known case of COVID-19 in the 4 weeks prior to their symptom onset, so we know that those children were exposed to a confirmed case. Idaho kids spend an average of 4.5 days in the hospital. It was 5.8 days for those who were actually admitted to the ICU, which is about 58% of Idaho cases. and those children spent an average of just over 4 days in ICU. The average age of those admitted to the ICU is a little bit older. It's 11 years compared with 7.5 years for those who are not admitted to ICU. Now, I did want to walk you through Idaho cases compared to the US. So I am going to go ahead and share my screen. And of course, there's going to be this awkward pause while I do so. So you should be seeing a table with data on it. Yes, so this is a comparison of Idaho cases to the characteristics of cases in the US. So far, there have been 3,185 cases reported nationwide, including 36 deaths, and that represents a case fatality rate of just over 1%. In Idaho, our 26 cases have been identified, but thankfully, all of these children have been discharged from the hospital, and we've had no deaths reported. A slightly lower proportion of Idaho cases are of Hispanic ethnicity, but this proportion does align pretty closely with the proportion of children in Idaho who are of Hispanic ethnicity, which hovers just under 30%. And as you can see, the median age of cases is identical when you compare the US to Idaho. And while our data do skew a little bit older, we do not differ much with regard to the age distribution of cases. I did include an age group of 12 to 15 years for the Idaho data, and of course that age group aligns with the age group the Pfizer vaccine was most recently authorized for. And although there's no comparison group in the national data, you can see that 26% of our MIS-C cases in Idaho are among kids in that age group. And for those of you who are desperately trying to snag the screen or do a screenshot, I think I can ask Niki to send out this particular slide at the after the press briefing for those of you who would like to have it. And with that, I will turn it back over to Niki.
Okay, thank you, Dr. Turner, and I will be happy to share that slide with anybody who wants it. So at this point, we'll now take questions from the media participants. Most of you know the drill, but I'll just go through it again. Please raise your hand by selecting the hand icon in the lower right part of your screen. I see some of you are already doing that. You can also type your question into the chat area, which you can also access in the lower right part of your screen. So when I say your name, please unmute yourself and announce your name and media outlet before asking your question. And please remember to clear your hand when you're done. And with that, we'll start off with Audrey Dutton.
Good afternoon, Audrey Dutton from the Idaho Capital Sun. I am curious about longer term effects among children. There have been some reports, not out of Idaho, of children having long COVID-esque kind of symptoms, fatigue, brain fog, pain, and I'm wondering if anyone has heard of this happening in Idaho as well.
Thanks, Audrey. I'm going to see if Dr. Turner or Dr. Hahn would like to address that.
Audrey, this is Kathy. So we do not, as you know, we do not follow cases long term. So our case investigations are at the, kind of at the acute state of infection, and we don't follow people long term. However, there are some clinics around the state that are specifically targeted toward people who are experiencing extended illness or extended symptoms of COVID-19, maybe after they've recovered from that acute phase. In our neck of the woods, I know St. Al's has a clinic specifically for COVID-19 and for treating those patients. And while we don't have those data, I'm certain the clinic would be able to provide some information. And I'll ask Dr. Hahn if she has anything to add there.
Dr. Hahn, I think you're on mute there.
It's not showing that she's on mute.
Yeah, I'm not. I'm going to mute her and then unmute her. See if that helps. No? Uh-oh.
Maybe we can jump back to that if we want.
Yeah, Dr. Hahn, it might be good for you to go out and then try to come back in. if you can. In the meantime, we'll move on to our next question, and that will come from Kyle Pfannenstiel.
Thanks, Niki. This is Kyle Pfannenstiel with the Post Register. I'm looking at the vaccine data dashboard, the allocation data. It looks like we've only been delivered 22,000 doses this week, which appears to be a big drop off from previous weeks. How many doses were we offered this week, and how many did we decline?
Thanks, Kyle. I'm going to ask Sarah Leeds, the Immunization Program Manager, if she wants to address that question.
Sure. I need to look for an exact number, but it's around 88,000. It's a little over 88,000 this week. And our providers ordered about 25% of that.
Why did we only order a quarter of the doses we were offered?
Because the vaccine demand is waning, and providers don't want to have that much vaccine on hand. We're working with them to ensure that all providers have enough inventory that they can vaccinate anyone who can walk in. But right now, they have sufficient supplies to meet demand.
Thanks.
Okay, our next question is going to come from Elizabeth Hadley.
Hi, I am Elizabeth Hadley. I'm from KMVT News here in Twin Falls. I have two questions. One of them is why was the demand for getting a vaccine so high, like back in January, February, and people were like waiting and calling and trying to get on the list, but then now it's like you can just walk in and get one.
Thanks, Elizabeth. You said you had two questions, so I was waiting for the next one, but I can start with that. Okay, I'll address that question. You can always ask your next one if you have another one. You asked why was demand so high in January, and now we're seeing such a rapid decline. Well, as we know, in the early stages of this, there was limited vaccine supply coming in. There were a lot of people with a lot of strong interest in getting the vaccine. And we had, of course, different population groups that we were very much targeting. Now that we've made our way through all of those priority groups, groups that were prioritized by our COVID-19 Vaccine Advisory Committee, or CVAC, we have seen over the course of time people having we've kind of flooded the market, if you will, of those people who have that interest in taking the vaccine. And now, and the easier groups, I think, to get to, they're employment-based groups at first, especially where you can just go into an employee situation, like a healthcare facility, vaccinate the people that are within that organization. And now that we've made it through those priority groups, that's part of the reason why I was talking about those mini grants, is because we want to be able to get the vaccine out into communities where people are. So maybe those people who don't have the ability to get into a clinic as readily, or they don't have a wide variety of healthcare providers providing vaccine in their communities. So we have an obligation to get those vaccines out into communities, and therefore we're trying to support providers to do some of that work. So coupled with, we've got through the easy groups and the people who are having high interest, and now we're on the other end of that, where it's more challenging groups and populations to serve, with also a waning interest is what we're seeing. So I'm going to continue to reiterate that we really are relying on all of you to help us get those vaccination rates up and use those vaccines that we have coming into the state. The more we can do that, the more we can return back to our normal lives.
That's great. Thank you. I appreciate that. My other question is, so on our news every night for KMVT here, we run like the Idaho Tracker, and we've been getting a few questions from people wondering how sometimes the numbers change from day to day of the people that have recovered, or I'm just wondering why or how it might be different from day to day with the numbers of people that have it, or is it, you know, they thought they had it and then they don't, or something like that? I just, we've been getting a lot of questions about that.
Okay, great. I'm going to see, Dr. Turner, do you want to take that?
Yeah, sure. So Elizabeth, without knowing a little bit more detail, I'll give you some general comments, and then maybe we can get a little bit more detail. So I think you might be referring to on the statewide cases tab, we have sort of these blue bands, and we have like the number of people who've recovered, the number who reported asymptomatic. So those data are updated every day. I can tell you that it's a quick calculation for the number of people who are recovered. It is anybody who has not died 30 days after their symptom onset, assuming that they're symptomatic. I can tell you that the asymptomatic numbers are the people who report no symptoms. So the numbers do change every day because case investigations are done every single day at our local public health district level. I will tell you, though, that the number of investigations being done on the weekends has diminished considerably since we were, since last summer, frankly. So our case counts do tend to dip on the weekends because we're just not doing as many investigations. Does that get to an answer?
Yeah, that does. So it's mostly just because of how long it takes, or how, you're going more in depth with their symptoms and things like that.
Yes. So we have, as they are doing investigations, they're asking about symptom onset date. And so there's a delay between when we would get a case reported and when we would consider that person recovered. On average, it's about 30 days.
Okay, great. Thank you.
Mm-hmm.
Okay, our next question is going to come from Erika Lee.
Hi, thanks, Niki. I have two questions. So I know that you guys opened eligibility to non-Idaho residents. So I just want to ask the percentage, or if you have any number of percentage of non-Idaho residents vaccinated in that number that you guys have said total vaccinated.
Thank you, Erika. I'm going to see if Sarah has that information.
I don't have that off the top of my head, Elke, but I'll see if I can figure that out really quickly before the end of the press conference. Otherwise, I'll send it to Niki.
Great, thank you.
And then another question I have is, what is the percentage of the people who are 16 and older that are eligible? What is that percentage compared to people who are eligible? Like, how many of them are vaccinated compared to those who are eligible? I know there's a number, but is there a percentage?
I'm thinking I understand the question. Director, you look like you're poised to respond, so give you that opportunity if you want.
Well, actually, I was thinking that Dr. Hahn mentioned that number in her comments, and so I might defer to her if she's back on, or I think Sarah or Kathy might have that.
Yeah. Can you hear me?
Oh, good, you are there. Okay, yes.
Yeah. I ditched the headset. I don't know if that was the problem, but yeah, and I just got kicked off. There's something weird going on. At any rate, yes, thank you, Director. Good memory. Yes, I did mention that Dr. Turner and I took a look at that this morning. And as of this morning, our percent of 16 and 17-year-olds that are vaccinated is around 15%.
Sorry, so many questions, but last one. Now that, those who are 12 and older are eligible, when will that data be available? I know it's still fairly new, but just wondering about that.
We should be able to, as soon as we start getting that age group vaccinated, we can start posting that as it comes through our immunization registry. So it will be captured along with all the rest of the information.
Okay, we'll move on to Rachel Cohen for our next question. Rachel, if you're speaking, you do not appear to be on mute, and I'm not hearing. I don't know if anybody else is hearing.
Not hearing
Rachel?
anything.
I wonder what's going on. All right, I'm gonna mute Rachel and, oh no, I think we lost her. Okay, I do have a question in chat. Just let me get here from Karen Bosick. She writes for Ion Sun Valley. She says Blaine County is approaching 80% vaccination rate, which would be considered herd immunity by some. Do you have any thoughts for the county guidance? Do you have any thoughts for the county around guidance or anything like that as it reaches that pinnacle? And what happens when tourists start returning to the county in June, perhaps vaccinated, perhaps not? Do residents have to retreat back to precautions?
That's a great question. And Dr. Hahn, I don't know if you would like to take a stab at the first part of it. We've talked about herd immunity.
Yeah, sure, happy to. Yeah, as I think the question includes the answer, kind of. As Karen alludes to, that is great. Blaine County is leading our state. We're very, pleased to see the high rate of immunization in Blaine County. But as Karen is well aware, you guys have so many folks coming through, not just from other parts of Idaho, but around the country, and even I know you're still getting some international travel. So I think it's going to be a challenge, and we would probably recommend, obviously the locals there, folks, the local community has been very active with their own ordinances and, very, very, very doing a great job there. But we would certainly support them if they wanted to stay, a little stricter, just because of all the travelers coming through and the inability to know who's vaccinated and who's not. So even though their numbers are great, I'm sure that the fact that so many people come through there warrants some consideration as the county decides how to move forward.
All right, thank you, Dr. Hahn. We'll try Rachel again. Looks like she's back in. Let's see if she's able to. Uh-oh, I see she took herself off mute, but I'm not hearing anything. Rachel, if you'd like to type your question in the chat, I can read that aloud as well. It doesn't appear that we are able to hear you.
She did chat.
Here, yes. So Rachel Cohen's question, Rachel works for Boise State Public Radio, and she says, I was wondering if anyone has any insight as to why the vaccination rate for individuals who are 85 and older is not quite as high as the rest of the 65 and older population, and how the state hopes to get those numbers closer to the 80% goal.
That's a great question. And of course, we want all populations to get their vaccination rates up, and I'm certain that a large proportion of the 85 and older are living in long-term care facilities. So I'm sure we got the largest swing as our first pass through the long-term care facilities and doing their vaccination rates. And I'm going to see if Sarah Leeds has any further detail on some of the work that she's doing with the health districts and vaccinating the older population, and turn it over to others as well.
Yeah, Elke, we are continuing to strategize, the different ways that we can vaccinate the older population and increase that rate. We are working with the Office of Communications as they do some surveys and polling of what is now the most latest of why people are not getting vaccinated. Some of the things we're hearing from providers, and this is really across all age spans, is that they're still waiting to see, I want to wait and see. And so really, I think we just need to strategize a lot of different ways to persuade and figure out what is it that those folks are waiting for? Is it just time and additional safety data? Is it really, just seeing how their friends react to the vaccine? There's just a lot of different things at play, and we're even seeing, trying to determine what kind of incentives we can work with the private sector on. may influence folks to get vaccinated as well. And so really, we're working on multi-pronged approaches to persuade folks to choose to get vaccinated.
And maybe, Sarah, I would add also that, that they might also be part of that homebound population, and some of these mini grants for mobile vaccination will help with that. I know even in some parts of the state, local public health is working with EMS agencies and fire agencies to go into people's homes. So I think the more we have the flexibility to be able to do that, we'll likely be able to get some of those vaccination rates up even higher.
Thanks, Elke.
All right, thank you both. Our next question is going to come from Celina Van Hyning.
Hi, thank you. I'm Celina Van Hyning with KTVB. So I had a question about the move from stage 3 to stage 4. It kind of seems that with this modified stage 3 we were in, it's not much different from stage 4 that we're currently in, with the exception of group sizes and gathering restrictions. So I was just wondering if it might be a question for the director, if you could just speak a little bit more on the differences between stage 3 and stage 4.
Director, go ahead.
Right. Thank you, Celina, for the question. That is the main difference. Is in stage 3 that we were in, there was we had a recommended limit of 50, a group of gathering sizes of up to 50. And above that, to work with your public health district for those group gatherings over the size of 50. The significant change really is that now there's no recommended limit for the size of gatherings. However, we are still recommending that that individuals that are organizing gatherings or running events, that they have safety protocols in place. And we have some examples of those on the website, coronavirus.idaho.gov. And they're always free to work with their health districts as well for advice on how to have a safe event. But that is the significant change. We are encouraging folks to get vaccinated as part of stage 4, and you've heard us talk about that as well. But the guidance really remains the same around the protocols for how to have a safe gathering. Just the change is it's no longer a recommended limit of 50.
Thank you, Director. And then just one quick follow-up, if I could. So you mentioned stage 4 encouraging Idahoans to get vaccinated and for people to continue getting vaccinated. So how will our vaccination rates impact how we move between stages moving forward? I don't know if that makes sense.
It does, Celina, and I'll go ahead and take that. We obviously are watching very closely our vaccination rates. We have those, as you know, on our dashboard, and we've talked about them a lot in this call here. However, the thing that has been our North Star from the beginning and will continue to be our North Star of whether we need to take additional action is really around the number of cases going into the hospitals and whether our healthcare capacity is under any type of strain. And so a leading indicator for that is vaccinations, and we are clearly interested in as many people choosing to get vaccinated as we can. That are willing to do so. But what we're really watch, as we have all along, is really what's happening to our healthcare capacity. And as I said earlier, the vast majority, I think 83% of hospitals are operating as normal, and there's no hospital in the state that has any type of a resource limitation that's going on. And so we actually feel very good about our hospital capacity right now. But that's going to be the real bellwether of whether we need to take action down the road, is if our healthcare capacity is under strain or at risk.
Thank you, Director.
All right. Our next question is going to come from Ian Stevenson.
Thanks, Niki. This is Ian. I'm from the Idaho Statesman. I was wondering, as the demand for vaccines declines, whether the risk of vaccines getting wasted is rising, if appointments go unfilled or canceled, et cetera, and whether you all have any numbers on that.
I'll take the first part of that. So certainly, as we have vaccine demand diminishing or dropping and appointments going unfilled, we do know that there's going to be an increase in wastage, and we are also encouraging providers to take advantage of the opportunity when they have someone in their office to open up a vial. And I think Sarah talked about this last time too. We want to encourage those providers to open up that vial, give that vaccine to the people who are there, take advantage of that moment in time. knowing that it might put some vaccine at risk of being wasted if they can't fill, further vaccinations. In terms of the number or the percent of the vaccine coming in that we're counting as wastage, I'm going to have to ask Sarah to address that.
Can I ask what the question is? What percent is being wasted?
Mm-hmm.
It's a very, very small percent. As of today, we had 5,808 doses that had been reported as wastage, and that it's a not even 1% of our vaccine. We do expect that to go up, though, as we encourage providers to kind of shift that mindset of what we've been preaching, so to speak, for so many months when vaccine demand was so high, is, do everything you can to reduce wastage and not waste any doses. But the message is really just the opposite. While, we don't want random wastage, we are expecting that providers, if there's one person in your office in 2 or 3 days that wants that vaccine, please puncture that vial, administer that dose, and if the rest of the doses in that vial have to be wasted, we're expecting that. CDC is expecting that, and we want every person who chooses to get a vaccine to get that vaccine. That's just where we are in this effort right now.
Thank you. Is there what's the minimum size of the vials? And I'm wondering if it's possible that the shipment vial sizes may change going forward as to make that wastage less likely.
Yeah, Sarah.
Do you want me to continue that one, or do you want to?
No, go ahead.
Okay. We are hoping that CDC is going to change that number. Well, CDC doesn't control that, the manufacturers do, but immunization programs around the country have asked for smaller numbers of doses in a vial. And the change, especially with Moderna is now more doses in a vial than had previously been available. And we, I think, made our last order of 10 doses per vial this week or last week. And now there's 14 doses in a vial. And that is incredibly problematic for the situation that we find ourselves in, not only in Idaho, but across the country with waning interest in the vaccine. So we hope that the manufacturers will respond within a few months to give us vials that are, even single dose vials would be incredible, but we don't know when that's going to happen. We do know that sometime this summer, Pfizer is going to be making available less vials in a tray, so that providers can have, right now there are 195 vials in a tray of vaccine is the minimum order for one tray. And sometime this summer, Pfizer is making available 25 vial trays. And that will go a long way in helping us, have to ship directly to providers, because 1,170 doses is a lot for one provider to have on hand. So that will help, and whenever we can get smaller numbers of doses in a vial, will be additional help for us.
Thank you.
Niki, we do have, I think you're on mute first off.
Yes, thank you.
And we do have a response to Erika Lee's earlier question about the percent of non-Idaho residents that have been vaccinated.
Uh-huh.
So Sarah, do you want to go ahead and respond to that?
Yep, sorry, couldn't unmute. Tongue twisting. About 3% of the people who've been vaccinated are not from Idaho. So that's the most recent numbers we have.
Okay, thanks, Sarah. It looks like Erika Lee has another question.
No, sorry, I just forgot to lower my hand. No worries.
Okay, All right, no problem. Thank you. We'll go to Kyle Pfannenstiel, who also has his hand raised.
Thanks. This is Kyle Pfannenstiel from the Post Register again. I wanted to ask really quickly, how should parents and kids who want the vaccine go about finding sites that they can get Pfizer at?
Thanks, Kyle. We have done some additional work on our website. If you go to the pre-registration tool, you'll see that there's more information available. There's also vaccines.gov, which is sort of the national platform that's been, it used to be Vaccine Finder, that's been kind of reimagined. They now have some different services that are also available. And Dr. Hahn has put it in the chat, which is www.vaccines.gov. It's a pretty snazzy site, and it's also linked to our site as well. So we know that we're encouraging providers to show which types of vaccines that they have available. And I'll see if Sarah or Dr. Hahn have anything they want to add to that.
Thanks, Elke. Yeah, I agree. I think this is actually a really nice site. It's super easy to use. Whoever's looking for vaccines just needs to know their zip code, and then you can select which vaccines you're looking for. So if you're really looking for Pfizer, which of course a lot of parents are, you can just say, just only show me where Pfizer is. Most of them right now that are in there are the pharmacies, but I think more of the family practice providers and public health districts and so forth are also getting listed in this site now. So, but there are, for most parts of Idaho, we did a little test a few weeks ago, just put in a bunch of the Idaho zip codes, and most people will be able to find quite a few providers in their area.
And I would just add that you can search for within 1 mile, 5 mile, 10 mile, 25, and I think up to 50 mile radius in your region for how far you're willing to travel for a specific brand of vaccine.
Okay, I don't see, I see Erika Lee has her hand up. I don't know if she took it down and put it back up. But I'm not seeing any other hands at this point, and she is not unmuting herself. So that will be the last question that we have today. So we'll go ahead and wrap it up. We are planning another media briefing at 2:30 p.m. Mountain Time on Tuesday, May 25th. So that's 2 weeks from today. You can watch for those details on Monday, May 24th. Thank you for joining us today.